Hi, I'm Dr. Noelle Lucas from Blue Oasis Pet Hospital, and I'm here to answer a few more questions that have been brought to my attention about dog surgery, and I'm going to ask my husband to ask me some of those questions.
Dr. Lucas, what are the associated risks with dog surgeries?
So associated with risks with dog surgery, well, one is, one of the big ones is general anesthesia. So we are going to take that pet dog from being conscious to unconscious, and when that happens, there's always a risk that we can't always control everything that's going to happen under general anesthesia, but we make a lot of attempts to have really high standards and make it as safe as we can and individual and customized to that individual dog that we're going to take under anesthesia and do surgery on. And then one of the other big risks or concerns is what are the potential complications of that surgery. So we're going to talk a little bit more about what those complications may be.
Is there certain dog breeds that have higher risk factors when they go into surgical?
Yeah, so there are definitely breeds that are known to be a little bit more delicate when it comes to putting them under general anesthesia. One of the dog sort of categories that we treat a little bit differently would be our brachycephalic dog breeds, so the smushy face ones, so like our Frenchies and our Bulldogs and our Boston Terriers and our Pekingese and our little Shih Tzus. Those little guys have really long, soft palates and smaller tracheas and just a lot more airway constriction. So that is a class of dogs that we're going to treat a little bit more specially when it comes to anesthesia. And then, a lot of the dogs, there's such a wide variety of dogs, but the brachycephalic ones we do put in a little special class of their own when it comes to anesthesia.
How do you minimize dog surgery risks?
So minimizing risk is really starts with having a well-prepared veterinary team. So good trained team, good protocols in place, having a calm pet come into the hospital when we start doing calming meds at home. That helps reduce their fear, anxiety, and stress when they come in. It lowers their adrenaline, helps the process go smoother. IV catheters, good sterile instrumentation, good surgical technique, sterile, sterility in the surgical field. All of those things will minimize risk of general anesthesia and surgery.
Is anesthesia always necessary?
So not always. So most of our surgical procedures are performed under general anesthesia. But again, it just depends on the procedure that's being performed. I talked a little bit about if your pet has just some masses or little lumps and bumps on the skin, that doesn't always require general anesthesia. We can just give them a really nice little sedative injection and really numb up those areas with a local nerve block. And we can usually pop those off without any general anesthesia and no discomfort to your pet. So it really, again, depends on the procedure that we're going to perform for your dog in the surgical sense. So if you have a dog that needs something done surgically and you have some questions, we invite you to reach out to your veterinary team to answer those questions. And if you're in the Mount Juliet or Nashville area, we'd like to see you here at Blue Oasis Pet Hospital. Thanks.